When the pandemic hit, many things changed for many families.
This became extremely unsafe for anyone to allow outsiders into their home, let alone for the most medically fragile kids, and so we didn't.
Gabriel Triplett's 10-year-old son, Oscar, qualifies for disability services through Medicaid, including in-home hours staffed by a support worker. But under a federal public health emergency that began in 2020, his parents could fill that role.
The red tape was allowed to fall away, and his mom was allowed to be paid to be his caregiver. And since that happened, my son has not been admitted to the hospital. Being admitted to the hospital was a common thing for us before this program.
Dozens shared similar stories and hope to make this temporary exception into a permanent program, citing better care on top of a severe lack of support workers. This week, they brought those experiences to a committee hearing in Salem.
For the last 2 years, Oregon's disabled children were saved from poverty, from unnecessary foster care, group home, and crisis care placements.
Avery's medical complexities, combined with being nonverbal, make it very challenging to keep him safe and healthy.
There's simply not enough qualified care, and it's not going to change anytime soon.
No one can read Taryn's discomfort or pain signals better, spot seizure activity faster, make him smile bigger, or bring out his winning personality like his mom and dad. No one.
Most are calling for the passage of Senate Bill 646, sponsored by Senator Tim Knopp. It's a broad measure, adding to the state Medicaid plan and allowing even more families to qualify.
What moves me about this is that these parents are struggling.
But there's another bill, Senate Bill 91. Introduced by the Senate Committee on Human Services, that's narrower than the parent advocates would like.
It would allow children who have the highest needs, and that would be determined by a service level of very high due to medical needs or very high due to behavioral needs. They would be able to pay their parents.
Committee Chair Senator Sarah Gelser-Bluen explained the first proposal has far too big a price tag, and even the second would need tailoring.
I have had conversations with budget writers and leadership who have informed me that even Senate Bill 91 is probably too big.
Parents argue this program won't be as costly as lawmakers predict, and it wouldn't displace providers outside of the family.
It's not us versus them, one or the other. We need a fully functional system of care. A paid parent program is one piece of that puzzle.
Advocates are pushing to have something in place soon as the public health emergency comes to an end in May.
We will compromise to where we have to be, but we are trying our hardest to make this as inclusive as possible.
Now, yesterday, only one person testified against the broader bill. As for what comes next, more discussion and a work session. A bill must be voted out of the committee by the beginning of April.
Thanks, Alma. Appreciate your follow-up.